Dr. Kelly, Dr. Samina. We wanted to talk to you a little bit about PCOS because September is PCOS Awareness Month. So we really want to spread awareness and want everyone to know what PCOS is and how it gets diagnosed, because 1 in 10 women in North America actually have PCOS, which is a little bit staggering.
Yeah, for sure. There's a lot of women out there who are suffering with it. And even I feel like patients who are out there who are undiagnosed.
Yeah,
and
absolutely.
That's why we're here today.
Yeah. So how do you diagnose PCOS? It's actually a little bit complicated. There is the Rotterdam criteria, which is requires that you have to have two of 3 things in order to be diagnosed with PCOS.
Yeah.
So the first is polycystic ovaries. The second is high androgens or male hormones, either in your blood work or physical symptoms of that. So that's like hirsutism, so hair growth, cystic acne, hair loss. And the last thing is long periods or not ovulating. So you only have to have 2 of those 3 criteria in order to have PCOS.
Yeah, so oftentimes patients will come and they'll say that they've had an ultrasound and that their ultrasound says they have PCO or PCOS, and they think that they have the whole syndrome. But in fact, that's just that they have like cysts on the ovaries or multiple follicles, and they don't necessarily have the full syndrome.
Right, exactly. Especially if you have had an ultrasound done in your teenage years, it's actually not abnormal to have cysts on your ovaries in your teenage years. Your hormones are changing. Sometimes you're not ovulating. So I've had patients come in and they've been told they have PCOS based on an ultrasound when they were 17, but they don't have any symptoms of high androgens, they don't have high androgens on blood work, and they have relatively normal periods. So in that case, they don't actually have PCOS.
Yeah. So it's really important, trying to figure out if you have the signs or symptoms of PCOS. So that's kind of where we come in to like really figure out what signs and symptoms is the patient presenting with that could lead us to believe that they have the syndrome, which is PCOS, so polycystic ovarian syndrome. And oftentimes the diagnosis is based on blood work as well as an ultrasound.
Yeah, absolutely.
Because that's where we're looking to see if the patient has a cyst on the ovaries, and then do they actually have high testosterone in their blood? But then again, like Kelly mentioned, sometimes patients don't even have high testosterone in their blood, and we're using clinical signs and symptoms to figure out if they have high testosterone.
Yeah, exactly. So if you have hair growth under your chin, you have acne and hair loss, even if your blood work doesn't say you have high testosterone, those are all very testosterone-driven signs, so we can almost assume that,
Yeah, and it's very hard to test for testosterone in blood work. Oftentimes, like the testosterone actually, because it's so small, lives in the capillaries of the blood or the vasculature, so it can be hard for us to actually see it on blood work. So oftentimes people will run like a free and total testosterone and it'll look perfectly normal. But then I would like actually encourage you to like look at other markers like androstenedione, DHT, but even DHT now isn't that accurate on Life Lab. So I would say, clinical signs and symptoms are one of the biggest things that we look at.
Yeah, 100% agree.
Yeah. So, getting diagnosed with PCOS can be really complicated. Sometimes even patients feel like they have the symptoms, but no one necessarily is looking for PCOS. So if you feel like you have the signs and symptoms of PCOS, then I would encourage you to see like your medical doctor or a healthcare professional, like a naturopathic doctor, who can really look to see if you do have PCOS and figure it out with you. Because once you know, it's great, because then you
can treat it.
Yeah, exactly. There's so many things that we can do, especially diet and lifestyle and supplements, to really help support this syndrome.
Yeah, absolutely. And PCOS is not like an infertility sentence. A lot of patients come in and they're worried, they've been told they have PCOS, they can't get pregnant. And that's not necessarily true. So if you think you have PCOS, you can reach out to us or reach out to your medical doctor, get it diagnosed, and then go from there.
Yeah. Well, this month is PCOS Awareness Month, like Dr. Kelly said. So we're going to jump on every weekend and chat about PCOS and, different topics about it. If you have anything that you are interested in learning, please send us a direct message and we'll make sure that we cover it.
Sounds good. Have a great day,
Bye,
everyone.
guys.
Bye.